Good afternoon, delegates, esteemed panelists, and participants. My name is Ameena Zia. I am the founder of Blue Ridge Impact Consulting. We're a social impact firm working across private and public sectors to ensure stakeholder approach to development. I have been engaged at the United Nations civil society space since before the global goals were adopted in 2015 by over 180 world leaders as the framework, as the guiding tool to help achieve sustainable development. I'm very excited as we, the global civil society community, continues to recognize not only the shortfalls of SDGs, but also work towards the challenges to the future with innovation and technology in mind. Today, I have been invited to represent American TelePhysicians. It is a revolutionary global healthcare project that provides a holistic approach to interconnected healthcare ecosystems. The organization's corporate goals follow the Agenda 2030 framework for providing access to quality healthcare to all, and currently are working in healthcare markets in the United States, in Australia, Mexico, Nigeria, in Kenya, Pakistan, and in the United Arab Emirates. American TelePhysicians is also a key partner of Sustainable Development Platform for Partnerships. The ECOSOC Forum and this discussion today, particularly as we come together, talking about emerging markets into the conversation around digitizing healthcare ecosystems during a very crucial time that we find ourselves in, is part of a planning process towards the road to the 2021 high-level political forum, which we at Blue Ridge Impact Consulting are working with organizations like American TelePhysicians to coordinate, support, and impact around multi-stakeholder approach to development. So today's intergenerational discussion is not only supposed to be a source, a platform for inspiration, but also a significant dialogue that holds a lot of value for the sponsors and the community of panelists and their networks today. In 2018, I would like to share the American TelePhysicians was invited to make recommendations at the high-level political forum where Youth 2030, the United Nations strategy, was launched. And as part of the global community, we recognize that development is accelerated when the majority of the youth in any country are able to make significant contributions to economic, social, and political life. And as more than half of the world's population today is under the age of 30, responding to the needs and the aspirations of young people is an urgent need for today and for the challenge of the future. So as Youth 2030 is a system-wide strategy that helps guide the United Nations and its partners in global development to work meaningfully along with young people around the world. We find that this is such a unique strategy because at the center of it all is sustainable development, and it acts as that umbrella framework that provides implementation steps and tools on how to work with young people for young people in the areas of peace and security, human rights, and of course, sustainable development. And our panelists today are working diligently towards aligning and implementing these guided principles along their respective organizational models. And today we will share insights, we will share best practices and challenges and recommendations specifically for localized and impactful development. So as a capacity building exercise, the idea is to connect young people with innovation while harnessing information communication technologies around the world towards decision making that is unique, that is insightful, coordinated, coherent, and of course, part of a holistic system. As I sit here and I listen to all of our panelists share their experiences, I'm very appreciative of these very robust and very real discussions that highlight, the passion and the commitment and the very people-centric approach to development that has been adopted and continues to be adopted and implemented locally while also ensuring larger connectivity. Development discussions always must include conversations on solutions and on accountability and most of all, rights of all, especially the rights of youth. Youth in emerging markets are a large and growing group that make up about a third of each country's population. Youth are creative, youth are energized, we know they're intelligent, and they're full of hope. And even in the face of challenges, we've seen that. And most importantly, as the youth transition into their journey from childhood to adulthood, they need developed skills, they need access and opportunities to make decisions that we know will help shape the rest of their lives. And of course, by extension, the future of their families, their communities, countries, and the world. And so with equity and inclusion at the heart of development, we need to ensure that healthcare ecosystems and all actors align their impact with the 2030 Agenda for Sustainable Development, which of course sets forth goals for scalable progress and is rooted in universality. And we know that in today's recommendations, we tackled good health and well-being, we tackled quality education and gender equity, and even decent work and economic growth at some points. And these are all stretched across the 17 global goals. And recognizing that these connections and alignments are very important and are very impactful towards very supportive, holistic development, that is needed now in the present and of course in the future. We know that Dr. Ali focused on targeting gaps in healthcare, in quality control, and he mentioned COVID-19 disruptions. We know Dr. Figueroa shared information around social determinants of health and interconnectivity, and of course that very real multi-stakeholdership approach to solutions and youth empowerment. We also know that Dr. Tatiana focused on dignifying access to care. Dr. Tayyip Akhtar mentioned the need to streamline healthcare across the board for more efficiency and quality. And of course, Dr. Wakas, you mentioned throughout your, as you led this discussion, the role of your organization as it continues to play in the telemedicine market during the response and recovery efforts as we navigate the global COVID-19 pandemic. And your team has been able to scale your model across emerging markets and also has been able to develop healthcare markets within the United States and Australia, indicating a very localized solutions-based approach to achieving gains in a space within the global goal 3, which is of course quality, health, and well-being. So we know that your model can be scaled not just in the emerging markets, but also in the very mature and developed healthcare markets like the United States. And so that's very comforting to know that. It's very hopeful to know that. So this dialogue has again been very real because it was again rooted in real experience, very localized experiences, not just textbook or high-level policy that is traditionally a very top-down approach and is usually very disengaged from the need on the ground. And that is how we know that we create value to knowledge and knowledge sharing, and the need for us to utilize our youth by providing them with platforms of capacity building and leadership, empowerment, and fostering community leadership, and helping them become the change makers in their community, as so many of you mentioned today. So thank you to all the panelists for the meaningful and transformative work that all of you are doing in your own respective ways, and the way that you're helping to ensure innovation and youth engagement to make sure that we do have quality healthcare, or we work towards that quality healthcare and the delivery of healthcare and of new approaches to care. Our team at Blue Ridge Impact Consulting will take these discussions and recommendations and we'll share them with our panelists and audience, and also with the Youth Forum leadership, and of course with the ECOSOC President's Office. Thank you so much for this very insightful discussion.